Vascular surgeons can play a significant role in managing arthritis conditions, particularly osteoarthritis of the knees, through a procedure known as geniculate artery embolization. Osteoarthritis is a degenerative joint disease characterized by the breakdown of cartilage in the joints, leading to pain, stiffness, and decreased mobility. While traditional treatments for knee osteoarthritis include pain management, physical therapy, and in severe cases, joint replacement surgery, geniculate artery embolization offers a minimally invasive alternative. Here's how vascular surgeons contribute to managing knee osteoarthritis through geniculate artery embolization. Geniculate artery embolization involves using image-guided techniques to selectively block the tiny blood vessels, arteries, that supply blood to the knee joint. These arteries, known as geniculate arteries, contribute to inflammation and pain in arthritic knees. Vascular surgeons perform geniculate artery embolization using advanced imaging technologies like fluoroscopy or angiography. They insert a catheter through a small incision, typically in the groin, and guide it to the targeted geniculate arteries under real-time imaging. Once positioned, embolic agents, tiny particles or coils, are injected through the catheter to block the blood flow to these arteries. By reducing blood flow to the knee joint through geniculate artery embolization, vascular surgeons aim to alleviate pain and inflammation associated with osteoarthritis. This procedure is less invasive than surgical alternatives, which may involve longer recovery times and potential complications. Vascular surgeons evaluate patients for geniculate artery embolization based on their symptoms, medical history, and imaging findings. Studies have shown promising results in pain reduction and improvement in knee function following geniculate artery embolization. Patients typically experience relief within weeks to months after the procedure, with potential long-term benefits in managing osteoarthritis symptoms. In summary, vascular surgeons contribute to the management of osteoarthritis of the knees through geniculate artery embolization, offering a minimally invasive option to alleviate pain and improve quality of life for patients who may not be candidates for or prefer alternatives to joint replacement surgery. Their expertise in vascular interventions and collaborative approach with multidisciplinary teams are instrumental in providing effective care for arthritis conditions. Give us a call today at 480-668-5000.